Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have with us Casey, Miss Casey, here for her maintenance adjustment. Casey presented to us about 2 months ago. Original chief complaint was she came in saying, I think I have sciatica, or you'd been diagnosed with sciatica by another doctor. She was having pain in the left hip going down to the left knee. And what we did after an exam and close to x-ray and everything else, we determined that Casey had sacroiliac dysfunction on the left side, which can oftentimes mimic sciatica, but it's not true sciatica. There are joints in the pelvis that can misalign and become dysfunctional. And what will end up happening is it can send a pain down the leg, but usually not past the knee. The difference between a radiating sciatic pain and sacroiliac dysfunction is sciatica will usually go down past the knee, result in some numbness and tingling, almost an electric shock feeling down into the calf or into the foot, whereas referred pain from a sacroiliac joint will usually stop in and around the knee, and this will result in things like left trochanteric bursitis in her case, or left knee pain, iliotibial band syndrome, etc. So it's important to be able to do a proper exam, look at the x-rays, know how to evaluate the pelvis, know how to evaluate the sacrum and the lumbar spine, and differentiate between sacroiliac dysfunction and sciatica. Because all the time over the years, people come in with this issue, and they could have concomitants of both. You could have problems coming from the sciatic nerve in the lower lumbar, L3, L4, L5, S1 area, but also have some pelvic dysfunction with that. And there's often a misdiagnosis between sacroiliac dysfunction and sciatica. So you got to know the difference because it changes the adjustment with the patient, which you need to work on primarily. But Ms. Casey's been doing good we saw you about 4, 5, 6 times, right?
Okay.
We cleared out the knee pain, cleared out the leg pain, and now you're here for your monthly maintenance.
Yes.
All right, okay. So we have some new procedures for you today. Now you've experienced the biophysics table and some Gonstead adjusting that we did with the side posture. But today we get the manual neuro decompression adjustment called the ring dinger. And you have no idea what that's about, and that's okay.
Yeah.
Okay, so the purpose of including this adjustment, Casey, is to adjust your spine in as many dimensions as we can, all right? Like we discussed, we live in a 3-dimensional world, right? We live on an x-axis, a z-axis, and a y-axis. Most chiropractic techniques incorporate adjusting along the z-axis, that's the coming through the body, the front and back, and the x-axis, which is the side to side. But there's not really many techniques that involve adjusting on the up and down, on the y-axis, okay? So like we were talking about earlier, when we're able to adjust in 3 dimensions, and get as much mechanoreceptors firing, as many mechanoreceptors firing as we can in the joint, that increases the neurological input into the brain. So then your brain sends even a stronger signal back down to the body, telling your body to memorize and adhere to this new configuration movement. That is the neurology behind chiropractic. Some of the old school thought, and this still does happen to a certain degree, is, a bone gets out of alignment, presses on a nerve. That's certainly still the case in many clinical situations. But to improve the stay put value of those adjustments, we're learning that if we can adjust in 3 dimensions on all planes of dimension, we can lengthen the amount of time between adjustments. You get a longer result. So that's the whole science behind the decompression. Don't get me wrong, there is an orthopedic component to it as well, all right? If a joint is jammed up and we need to decompress that joint, we're getting a solid effect on the movement of the bone itself. So that's what I mean when I'm referring to an orthopedic concomitant, right? We're gonna change how the bone moves. But the neurological concomitant is what we discussed, all right? That's the neurological aspect of increasing that neurostem so we get a more powerful signal back from the brain to the body. And you get a longer clinical result as a result, clinical relief as a result, okay? Any questions for me?
No question.
You came in, your chief complaints today, maybe a little bit of stiffness in the neck, the original knee pain, the original sacroiliac problem?
No problem.
Was still good then.
Yep.
All right, we're gonna get you started right here on the biophysics table. Hold up there for me, ma'am. Let's get you lined up on this table properly. There you go. All right, let's start things off with a leg check. You're even. Let's bend the knees for me. Bend those knees, let them come up. Any tension in the low back with that?
No.
All right. You've got good movement up and down. Any sensitivity or tenderness?
No.
Sacrum's good. How about this right SI joint here?
It's good.
Tenderness in the left.
Good.
All right. See, I feel a little bit of edema in there, which is swelling. That's inflammation. Just checking your joint tension here. A couple of pockets of inflammation in here. Some tenderness on this right side. So we'll let all that, even though it's not causing you a symptom now, I can still feel some tension in here that we'll be able to release. All right, I'm gonna start by working in the sacrum. I'm gonna fill the table kick up, okay? L5, 4, good release there, 3. That was a big one. See, that's that pocket of inflammation I was telling you about. All right. Back check those legs. Even in the knees, stays even. Very good. All right, ma'am. Cervicals. Good release. Okay. Go ahead and roll over for me, Casey. Okay, we're going to be adjusting the head back over the shoulders. Okay, arms outstretched for me. There we go. Okay, hands on the tummy for me. Alright. Just let that leg angle. Okay, good release there. A little bit of release there. Alright, come sit up for me, ma'am. Spin this way. Wow. That was a big pop. Good. You sleep on that right side?
Yeah.
Must have slept on that side last night. So we started a new exercise regimen, yeah?
Yes.
Not so much with the running. We talked about how running it's great for the heart and lungs, but it'll beat up the knees, it'll beat up the pelvis. So just be measured when you do it. Run on a level surface. Use good shoes. Keep it under 4 miles, that sort of thing. Beyond that, the cardiovascular benefit really doesn't change that much, you know? I mean, you're doing 10-minute miles, you run 4, that's 40 minutes of cardio.
Yeah.
Other than that, you're just overworking the heart, or you're gonna start beating up your knees and your pelvis. Okay, you ready for that decompression?
I'm ready.
Okay. All right, I'll lower the table for you a little bit, okay? Just go ahead and have a seat right here, and I want you to lay face up with your head that way. All right, now to do this procedure, we want to get your spine in a neutral, relaxed position. To achieve this, we're going to elevate your legs, okay?
Okay.
right, just leave your legs dangle just like that. Table's gonna lift. Pretty fancy, huh?
Yeah.
Okay, that's a bit high for her. All right, there we go. Okay, now to keep your body from sliding, we need to pin you to the table.
Interesting.
Yeah. Use these big anchor pins. We're gonna be in the fleshy part of your side. That's gonna be a tight squeeze, all right? A little bit tighter than you think, because there's a lot of force associated with the adjustment. Definitely gonna be on that last pin.
Okay, my belt loop.
Yep. Okay, here we go. There we go. I think you're in there nice and snug. Good reflexes. Okay, now breathe through the nose. Okay, stay relaxed, lift the head for me a little bit. We're gonna use this towel for some leverage here. Okay, you wanna keep your back teeth touching, form casing. Breathe through the nose. And stay loose, wiggle your right toe. Breathe, 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 breathe. Keep breathing. Now you should have felt that go all the way down to the pelvis. I know you had no idea what this was or what to expect,
No.
but that's an adjustment on the y-axis. How low did you feel that?
Like, way.
Yeah, all the way down, okay? Pretty shocking, or you all right? You tolerated it good, see? You're still kicking even, that's great. All right, and we're gonna finish it, clearing out the cervicals here. Look at that, there's nothing left. There's nothing left to adjust. You did great, ma'am. You did great. All right, we'll sit you up, maybe get your reaction to that, what it felt like, and should feel better.
Yeah, it does
Right.
feel good.
Yeah, never had an adjustment like that, huh?
Never.
We've never been able to address that sort of relief. Now, what I've seen a lot with patients is there's sometimes some scar tissue in the spine that, because of the other dimensions we're adjusting, we don't really get to address that particular area of scar tissue. So the first 2 or 3, maybe 1 or 2 adjustments can be dramatic, but they tend to taper off as the spine gets cleared out. And your body adopts this new configuration of movement. So once we get through that, you'll be good to go. But shoot, you tolerated that real well.
Look at you.
Yeah. So how did it feel? What did it feel like?
It felt really good. A lot of cracking up here, but then I felt it shoot down my spine. But yeah, I felt good. You're the first chiropractor I've been to, so.
Okay, well there you go. So you might be a little bit sore from the adjustment, but we manage that with stretching and ice. And the best way to ice is you get a Ziploc bag, put some crushed ice in it, put it on any sore spots. Soreness is to be expected because we made a rather big change to the spine all at once. But very manageable, and yeah, should clear up less than 72 hours, okay?
Okay.
You have any questions for me?
No.
All right, wonderful. Well, thanks for letting us record the adjustment video of the encounter. All right,
You're welcome.
this is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.